Hey everyone, Dr. Ashley here, and I have a question for you. Have you been dealing with nagging shin pain that won't go away? Well, today's topic of conversation is shin splints versus stress fracture and how you can possibly recognize the difference between the two if you've been dealing with that shin pain that just won't subside over time. So let's get started. Being able to recognize the difference between stress fracture and shin splint is super important. The reason being is they mean two totally different things when it comes to sports. If you're an athlete, a shin splint basically means you can keep playing through it to a certain extent as long as you're treating it properly. When you have a stress fracture, you actually need to be taken out of sport. So let's get started in talking about the anatomy behind shin splints and stress fractures, where they might occur, and after that, we will talk a little bit more about how during activity you may be able to recognize the signs and symptoms of one or the other. So here we go. All right, folks, let's talk a little bit more about what you need to know about shin splints versus stress fractures. They're often confused for each other, and we really need to make sure that you are catching the right thing at the right time to make sure you are taking the best care of yourself. So what do we see here? We see the lower leg. This is often where shin splints and stress fractures occur, especially in this guy right here called the tibia. Okay, you can also see a stress fracture occur in this little guy on the outside here called the fibula, but for the purpose of today, we are talking about the inside of the leg. You can also see you can see shin splints also occur kind of through here, this anterolateral portion of the leg, but once again, we are going to focus mainly in this area. The reason being, this is where shin splints and stress fractures occur most often in the lower limb, and especially for those athletes or for individuals who have repetitive trauma on one area of the body. Whether you're running, jumping regularly, that's something to remember. So what to know here? When we are dealing with a shin splint, you are dealing with an inflammation of the muscles that sit right in this region, especially the ones that attach right to the bone. That's why they become uncomfortable, okay? And what you'll typically recognize is that you will have more of a kind of diffuse discomfort. It will span up and down the leg a little bit more, greater than 5 centimeters in length, and that is what you should note there, okay? If you are dealing with a stress fracture, typically in stress fracture scenarios, we see a little bit of a crack in that bone. It's typically clinically diagnosed by an MRI, but there are some things that you can kind of say to yourself or you can kind of feel that may give you a little bit more insight as to stress fracture versus shin splint. But with this kind of stress fracture scenario, what you feel is a little bit more of a focalized pain. So the pain will be a little bit more in a smaller area. So you're going to say something like this. It's going to be right there, right in focal, and typically less than 5 centimeters in length. And that's just something to remember. So let's go ahead, since you have your little anatomy lesson here, and get started in talking about how you may recognize the signs of shin splints versus stress fracture during activity. All right, I'll add here. Isn't this app pretty cool? It's actually called the Visible Body app. This is the Atlas version, and it is great for any anatomy junkie out there or anybody who needs to teach different things to individuals about the human body. So sign onto your app store and check it out. So if you haven't already, make sure that you hit the subscribe button below and share us with your friends, especially if you're enjoying our content. And make sure you stay tuned, because I'm going to talk a little bit about how you can possibly recognize the signs and symptoms of shin splints versus stress fractures with activity. So how can you tell the difference between a shin splint and a stress fracture with activity? These are just kind of clinical pearls that we use that we wanted to share to give you guys some idea as to how can you possibly recognize the difference. So when it comes to a shin splint, typically what we're dealing with is pain that is more diffuse. So I've already talked about this. It is greater than 5 centimeters in length, okay? So that's up and down the shin bone. What you'll also see is that when you are dealing with a shin splint versus a stress fracture, you will have a warm-up phenomenon. So as you do activity, shin splints typically get better. They don't get worse. When they're worse is typically when you're not moving. First thing when you wake up in the morning, or basically at nighttime when you're just sitting idle. As we decrease the blood flow to that area, tissues start to stiffen back up again. The other thing that you should look out for here is that if you're experiencing on both sides, more than likely you are dealing with a shin splint and not a stress fracture. Stress fractures tend to be unilateral. Shin splints can be bilateral, but that's not always. You can have a unilateral shin splint as well. So what about stress fractures? Well, with every step you take, it gets worse. More than likely, as you do more activity, you're gonna have pain ramping up faster and faster. The other thing is typically these actually feel better at rest. When you first wake up in the morning, you're not gonna have pain there. It's actually gonna be decreased, and it may have subsided a bit. However, that's not always true. Sometimes with these type of injuries, you have constant pain, doesn't go away. And that's also something else that should lead you to think, hey, something is really going on here. The last thing, as I already said, typically with a stress fracture, you're gonna have unilateral pain. And that's a big thing. So just think about these things as you are dealing with shin pain and keep them in the back of your mind. Reason being, you don't necessarily want to miss one or the other because it will mean there will be differences in your ability to participate in your athletic activities. All right, everybody. Well, that's a wrap on my talk about stress fractures versus shin splints. But if you missed some of it, here's a chart to sum it up. You don't want to mistake one for the other. The reason being is when you do have a stress fracture, you will be out of sport for a certain period of time. If you're dealing with a shin splint, as long as you're treating it properly, you can keep doing what you're doing. Keep running, keep playing soccer, keep playing any sport that you'd like. Just make sure it's not getting too bad, because a mistreated shin splint can ultimately turn into a stress fracture. But just remember the things that we've talked about and make sure you're monitoring yourself, especially the next time that you experience shin pain. And as always, if you have any questions or comments about what I've talked about in today's video, make sure you post them in the comment section below and we'll get back to you as soon as we possibly can. As always, I'll be back soon with some more information, and I'm looking forward to it.